There's two components to our screening methods that we have now, and the pap smear is the main component still. So the two parts are cytology, meaning that we take a sample of cells from the cervix and those go off to the lab, and the pathologist actually looks at the cells to see if they look normal, if there's any abnormality to them. The second component is done based on your age, or if there are abnormal cells seen, and that's the HPV test. So this is a unique type of cancer where a virus actually leads to these changes in the cells that can progress to cancer. And HPV is a virus that can cause cancer in the cervix. So the HPV virus can infect squamous cells, skin cells, and lead to these changes. The HPV vaccine has been a wonderful development in gynecology. It's amazing to have a vaccine that can prevent cancer. It prevents cervical cellular changes. So even though you may screen positive at one point for an HPV infection, but it prevents that to progressing to cervical changes. I recommend the HPV vaccine for all age categories who have not received the vaccine yet. It is most important for our young people in that early age range of the vaccine, 9 to 12, 13, 14, to get the vaccine, because this is the age range that is not likely to have been exposed to the HPV virus yet. And of course, that's when it is most effective. We've learned in the older age category that 27 to 45 age range that they've studied more recently, that it is 88% effective in preventing these cellular changes, so still very effective. But if you haven't had the opportunity to be exposed to the virus, it's just that much more effective. It's very important to stay on top of any preventative health, and pap smear is no different. So keeping up on the screening, so some people might think, well, I haven't been exposed to the HPV virus, maybe I don't need to continue with screening. We think the virus may be able to kind of reactivate. So you may not need a new infection to become HPV positive again. It could be that your immune system has suppressed the virus so that it wasn't active or wasn't detected, but it could reactivate. It wouldn't have to be a new infection potentially. So even for people who have been in a monogamous relationship, it is still important to get the screening exams on schedule. I really want to encourage everyone to just stay on top of preventative health in general, including your pap smears or whatever screening is recommended for your age group. And if you have any questions, certainly ask your doctor. If you have questions about the HPV vaccine, if it's appropriate for you, or if you have any concerns about it, express those concerns, and you can have that conversation and get answers to whatever is bothering you. I invite you to come and see me at my clinic, me or any of my colleagues. We'd be happy to talk about HPV, cervical cancer, or anything else that's on your mind. We'd be happy to be a part of your healthcare.